I assume we have quorum, maybe even in the room.
But why are they sitting at a separate table?
I know.
Father?
Oh, really?
This is your table.
This is our table.
How dare you?
I don't like this at all.
Observation.
The youth council says nay, get over here. Let's take a vote.
Come over here. It feels like a class system. I don't like it. Come over here.
Being proctor, yeah, you might as well I can't
Yeah.
cheat on this test.
All right, gang. If I have to, I will start the clap once if you can hear me. But I think I've got everybody's attention. So cool. Welcome, folks, both to the hybrid meeting of the System of Care Advisory Council in April 2025. We're going to go over some objectives. We'll do roll calls and talk about group agreements. Let's go to the next slide. All right. So again, grounding ourselves in our shared commitment to system improvement, we're going to hear from subcommittees centering mostly on folks' lived experience. We have legislative updates and legislative engagement updates, and shout out to the folks that testified this morning. Appreciate y'all. We've got room for public comment as always, and we're going to talk some relationship building and improving communication and collaboration through some activities. And thank you, Joylene, for checking in with folks to see how that's going. So, Annette, roll.
Thank you, Joylene. I'm going to need you to make that much better.
I was going to be impressed if you can read it.
Yeah.
Dang.
Let me see if I
Can you read the slides?
No.
let's see if I can pull it up for you here.
Oh, thank you.
If somebody will let me in.
Oh, got it.
Oh, are you not?
Sorry.
You can see it and read it for you if you want.
You would like?
Okay. I think we're,
Okay, good. Yeah,
Nice.
thank you, speaker. Yeah.
I'm pretty sure I've got it muted. Yeah. Okay. All right.
All right, thank you.
Yes.
All right, council members, roll call. I'm going to start with Allison Stark.
Here.
Thank you. Sonia Little Deer Evans.
I'm here.
Jackie Serrano. Here. Sandra Santos.
I'm here.
Robin Henderson and Anderson Dubois.
I'm here.
I'm here.
Thank you.
Good to
Welcome
see you.
back.
Yeah, nice to have you back.
Kyle Johnson.
Good to be back.
Adam's here.
Judge Mercedes is out. Jesus Nunez Pineda and Kati Mosley.
Here.
Yeah, good to see you, Jesus.
Good to see you too.
Emily Cooper, Dan Toma.
I'm here virtually. Sorry I'm not there in person, but I'm sparing you all whatever is passing between my child and I.
Yeah. Cindy Cecil, Ebony Clark.
Cindy's here.
Carissa Cousins, Zafir Michael Berry.
Hi. Carissa's here.
Jill Archer, April Flint Gerner.
Jill's still on sabbatical.
Lacey Andreessen, I'm here for April. She'll be joining us all at 1:30.
Okay. Dana Hiddle and Andrew Grover.
Andrew's here.
And we have an open seat, County Mental Health Program Director, and Alicia Overstreet and Adam Rodakowski. Alicia's here.
Adam's here.
All right, thank you. Back to Adam.
Back to me. So, Gare reminder, if we can go to the next. Oh, sorry, we didn't do group agreements. So, as always, right, I will repeat these, but I think we have them hopefully down by now. But be present, participate, practice respect, try not to interrupt folks and use the name and pronouns they introduce themselves with. Avoid acronyms and use the chat for clarifications. Since we are hybrid, maybe if we could have somebody, one of our wonderful staff who decided they didn't want to be at the table with us, even though it's our work together, if we could call out the chat, because some of us in the room don't have access to it, that would be great, just so we don't miss anything.
Should our staff introduce themselves in case some people don't know them all?
Yes, and I'll get to that in just a moment. Oh, no, it's okay. So,
Different table, it's different.
yes, varied and opposing ideas are welcome, but challenge ideas and not people, right? We are all in this together. Honor those with quieter voices, lean in or lean back. We're not going to problem solve individual situations or crises, but we've got the folks in the room that will help you if you'd like it after this. Focus on improving the system of care for Oregon. Be mindful of your power dynamics and those of others. And obviously, solutions are why we're here. So be solution oriented, please. The GARE tool, as always, just a reminder, this is what we use to consider racial disproportionality in our decisions. Those 4 questions are: what are the racial equity impacts of this decision? Who benefits from or is burdened by this decision? Are there strategies to mitigate unintended consequences? And is completion of the full racial equity worksheet warranted? So let's be sure to keep a mindful eye on that and call that out if we need to when we're talking about decision making. With that, I was asked to have our lovely team of individuals introduce themselves, our staff. So can we start with Corinna?
Hi, everybody. I'm Corinna Hazard. She, her pronouns. I'm here to support with meeting notes and other staffing issues. Please also, if you have any email issues, please let me know and I can fix that on anything that we're sending out.
So I should be talking to you. Okay.
Yeah.
Is that like a gentle nudge? Because I'll just call myself out. Okay.
Everybody, I'm very well team.
We'll get you a hat at the table.
That's why you get the corn.
Yeah, that's true. I think we can get
You'll work your way up to a whole table one day.
One day.
You can strategies. If you cannot hear me speaking, so I'm going to do that again over here.
Oh, so you're just gonna come over to the.
Hi, everybody. My name is Joy Link Carter, she, her pronouns, SOCAC staff. I'm here to support folks with lived expertise physically in this room. You have my number if you want to text me. I'm still able to help if there is a thing you want to share and you want it to be anonymous. I got your back. Anything else, send me a private message, text, email. We're at this meeting.
Yeah, this could have all been avoided if y'all just sat at the table.
Sorry. And I'll come over here too so you can hear me. Ann Williams, she, her pronouns, Executive Director, System of Care Advisory Council, trying hard not to share my own germs with the rest of you all. Thank you for being here.
I noticed that you came and stood over my
I
shoulder.
can't
Friendship.
So I think what we will ask is if there are questions of our staff who we work together with, we may ask you to come to the table if you're going to speak, because it sounds like it's a little tough for those that are remote. And there are open tables, so feel free to just come sit here with us if you'd like. That would be lovely.
Maybe we'll let you. I don't know.
Let the record
I mean-
show you've been invited.
I can move my stuff. You know.
So now
I might move my stuff.
we have introduced our staff, our lovely team. I'll turn it back over to you.
Okay.
grounding ourselves in our shared values. We're going to have Addie Smith, our strategic planning consultant, is here remotely to lead us through a small group activity to review, refine, and affirm the values we'll use as a screen while we work through the strategic planning process. Addie?
Thank you so much. That was such a great, perfect intro. I feel like you've made my job so much easier, so I appreciate that. I am going to share screen, and I just want the folks in the room to let me know if that's hard for them. I'm really, really bad at tech, so I apologize in advance and I appreciate everyone's patience. Is some feedback I've been getting is to apologize less and thank people more. So thank you for your patience, and I'm going to share this so it's nice and big. And I'm just going to orient us a little bit to the work. Can folks in the room hear me okay? Can I get a thumbs up from anyone just so I can make sure? Okay, awesome. I apologize for not being there in person. I love a good in-person meeting, so I appreciate that. So here's a little bit of the big, 10,000 foot overview of what we're talking when we're talking strategic planning. There are going to be goals. These are overarching long-term aspirations. I know you all are really excited about those, but we're going to talk about them at the next meeting. So don't worry, we're going to have time dedicated just to get the goals right, because those set the stage for everything. But even before that, what I want us to have a conversation about is value screens. How are we deciding what's going to go into the plan, right? So every goal has to pass through the value screens. Every objective pass through the value screens. Every action step has to pass through the value screens. I've had the pleasure of getting to join this group for a handful of meetings. And one of the things I've noticed that I've really admired about the work of the folks at the table and not at the table, because I think I'm catching that the staff have chosen to not sit at the table, is everyone here has been really value driven. And I really admire that. And so I feel like the exercise we're going to do today is going to come really naturally to folks, because I hear at every table I've been at with this group, not at the table and at the table, both, is leading with values and centering values. So that's what I want us to get to today, is to see if we can get to a place where we have some values that we can use to drive the entire process. Then we'll dig into the stuff that comes a little bit easier to me, which is like the goals, the objectives, the action steps, right? I'm like painfully linear and headed towards a target, but I want to make sure that the target we're headed to fits through these value screens. So I'm going to bring up on the next slide 4 values that staff and myself have heard come up over and over again. Don't worry, there's going to be time absolutely to talk about what's missing. So if something feels missing to you, that's what we're going to close with today. And I'm always missing things. I always need people to help, bring me back to center, bring me back into view. So I always want to create space for that. But we're going to start by talking about these 4 in small groups. So these are the 4 value screens: centers youth and families, advances equity, affordability, and quality, increases awareness and reduces stigma, and promotes sustainable change. Now, if I'm looking at the table correctly, and I think Anna offered to help me in the room, we are going to divide you into 3 groups in the room, and I'm going to have one really big group here online with me. And each of those groups is going to take the opportunity to dive just a little bit deeper into one of these. So I'm going to give the room just a minute to get into, or sort of, switch the way you're leaning to get into 3 groups. And then once you're in 3 groups, someone can just shout at me, we're good. And those of you online, sorry, you're all stuck with me. Uh-oh, they went quiet. That means they're good. And then Anna, since you're in the room and I think you can still hear me, why don't you assign out the first, second, and third, and those online, you're going to join me on promotes sustainable change. So once I see a thumbs up from folks in the room, I'll switch us back a screen so we can talk about the questions we're tackling today on these values. Oh, there's big paper. I love that. That's what I was hoping for. Now you can tell why I'm sad to not be in person. Big paper, sticky notes. I'm one of those. I see people moving. Okay, now I'm going to take us back. Remember, folks online, we're promote sustainable change. Folks in the room, you're going to get one of the top 3, and then you're going to talk about these questions. And I'm going to be the one watching the clock, but we're going to take about 10 minutes to just have this conversation. And I think what they're going to do in the room is mute us, so those of us online can just have an open conversation. So if you're with me online and willing, it'd be great if you would pop your cameras on. And then I'm going to assume, since I'm not hearing from them, they're in action mode, and we'll go ahead and jump into action mode. Let me check the chat. Perfect. Okay. You can watch me. I'll try to multitask. Okay. So promote sustainable change is what we're working on. Does anyone want to volunteer to be the scrivener, if you will, the note taker? Anyone excited about that?
I'm bad at it. I can't do it. Sorry.
I'll do it once I get back to the office, Abby. I just need a couple minutes.
Okay, sounds good.
Okay.
Anyone who wanted to jump in, by all means.
I was going to say I can take notes.
That would be so great. Thanks, Anderson. So, promotes sustainable change. How do we as a group want to define what promotes sustainable change means? This is just a total no wrong answer situation. What comes to mind for individuals? What does that mean?
I'd say something that is put in writing, maybe policy, something like that.
Ah, okay.
I would say that this is something that can actually be accomplished.
Okay. Something that can be accomplished. Something in writing.
I'm writing all this down also.
I love that. Good. Then I'll stop. Thank you for giving me permission to be more people focused.
I can't see you, but I can hear you repeating it. So I figured
You're very intuitive. That's exactly what I was doing. Other thoughts on this? How would we define promotes sustainable change?
It's a long-term commitment.
Yes, I love that. Long-term commitment.
Yeah, I would say it's actually achievable. I mean, we need to be realistic in making these goals achievable, or this plan achievable.
Achievable.
Yeah.
Long-term. Go ahead,
and I
please.
was just to those lines, I was going to say something that's feasible. And then when I think of long-term change, I think about, this cycle of also going back and evaluating to recalibrate to sustain the change too.
I love the idea of it being a cycle since it's sustainable. I love recalibrating. So checking on, is it still exactly right? Do we need to move it in a different direction?
And I would add, if it's sustainable, that means we have the resources to make that change.
Available resources. I love that too. One of the things that comes to mind for me when I hear sustainable is sort of like it's self-fulfilling, right? Like we've set it up in a way that it can continue on. So it's not just long-term, but it's going to last, which feels a little different to me than just long-term.
Right. There's almost, that makes me think about, how do we almost do the succession planning for the sustain? So it's how does it go and last beyond kind of the current folks at the table? And then I also think commitment, real commitment.
I like that. I like both commitment and sort of the idea of succession planning. And I love the goes beyond the folks at the table, right? If all of us didn't show up in 2 years, it would still be able to keep going with whoever was at the table. That's such a great way to capture that.
I think I would add, I'll just add one thing, sorry,
Yeah.
is around funding. It's not grant funded, it's not subsidy, it's not dependent upon whether, the levy gets passed or things it has sustainable funding built into a budget.
Great. Built-in funding, funding that's not grant funding or sort of iffy or time limited. That makes sense to me. So stepping away from just the definition and turning a little inward, right? What does this value, promote sustainable change? What does it mean to you? That may be as a person, that may be in your role at this table.
Yeah, I think impact and real outcomes.
Mm-hmm. Impact and real outcomes. You guys are like built-in strategic planners. I love this. You're
And then
already
I
like
think of
2 steps ahead.
the last thing I think of is accountability, because I think that we, at least from where I sit, I think the state and state agencies have responsibility for being accountable to change.
Absolutely. I think that's right. We want to be accountable. Who are you thinking we should be accountable to? What does that look like to ourselves, to the communities we serve, to the clients we serve, all of the above? Anyone can answer.
This is Emily, and my volume's horrible and I have a cold. But for me, I think ultimately who we're accountable to are the youth that are served by systems of care.
Great.
And the families.
Yeah.
Mm-hmm. The youth and the families that we're serving. I think that's wonderful. Other thoughts about what promotes sustainable change means to you?
I think for me, and I mean, it goes both also with I define it, but for me, it's intentionality. Um, it has to be intentional.
Mm-hmm. Mm-hmm. That makes sense. So it's not just sort of willy-nilly. It's something that's really thoughtful, really purposeful, really meaningful. That's kind of what I'm hearing.
Mm-hmm. With resources, right?
Yeah.
Sustainable in that, like, we ran out of resources that a lot of people have been talking about. But then as well, like in the direction that we're going with that change. And I think the other part, aside from intentionality, is that in my mind, it's transformational. You can actually see and feel that change really taking place when it comes down to it.
And
I love it. Jump in.
And
No,
sorry,
please.
This is Ebony. I'll be quiet after this because I don't know if my is naming that I'm here. So this is Ebony. And I'll try to see if I can figure out how to change the name. But I think about sustainability means that we have I think there's, especially with the work that we do, it requires policy in order for our efforts to be sustained. And I think that it's from my perspective and doing this for 26 years now, I feel like we have all these great ideas. We move forward as a system. We either forget to go back and think about the policy implications and things that we need to either shift, change, amend, or sunset from a policy perspective. And then all of our effort, is undone. And so I think that there's a real policy piece that has to be brought forward in order to assure that our efforts are sustained.
Mm-hmm. I love
the
that.
other thing that I would throw out is this is all collaborative, that it takes all of us to make this change, that we can't just rely on just a couple people, that we really need to come together as an entire group and really work together.
Great.
I think there's something.
I think that.
Oh, sorry.
No, please. I'm just reflecting back. So jump on my toes anytime.
Okay. I think there's something also in here about impact, because I think we want to make sure that we are leading from maybe our own ethical stance, but also we're aware of the impact of the decision making and our point of view being limited, and that there could be impact in other areas that we are not anticipating because it's not our lived experience.
Yes. As we were, talking about the GARE analysis at the beginning of the meeting today, I was thinking of exactly that. I love that you've brought that into this conversation. We have about 4 more minutes, so I'm going to move us to the next question, which is, where does this value fit into the work right now that we're doing here at SOC? So how do you see promoting sustainable change fitting into the work?
I think for me, it means that, sorry, that we're not promoting changes that are too philosophical, too out of reach, I mean, they can be big ideas, but they need to be ideas that we can actually accomplish, and have the resources and time and energy to put forth. I think the worst thing you can do is have a really amazing strategic plan that's all ideas, and then you come at the end of the period where you're looking back on what you've done and you're like, well, we got none of these things done because all of our ideas were not actionable and they were not sustainable long term.
Love that. I love the idea of making it attainable. So we want to be visioning, but we want to be taking actual steps we can take right now to move us towards those goals. That balance is really hard. And I've worked on strategic plans that go both ways, right? And so right down the middle is where you want to get, because you want to be visionary, but you want to have those concrete steps you can take. Ebony, your hand's up.
Yeah, and I was just gonna say that, where does it fit right now? I feel like, and not to take the easy answer, but feel like it applies in all that we do from A to Z, just because I think that, I think that actually SOCAC is one of, I feel like, the more functional tables, council bodies. But I think it's easy to waste people's time to be, sitting in all this conversation to get to nowhere. And as we're thinking about, first and foremost, the responsibility that we have to children and families, the responsibility that we have to Oregonians and to the public, and the responsibility that we have to make change and impact, then, we need to make sure that we're not, I can't think of the word, shooting the shit in a sense,
Yeah. We're walking the walk in addition to talking the talk, right? We're not just here talking about how great it will be, but then we're putting it into action. I love that. Attainable and actionable. It's like you guys took a page out of my strategic planning book. You're teeing this up really nicely. And last question with our last couple minutes are how can we use this value promoting sustainable change to help ourselves make smart choices during this strategic planning? What does it mean to you to use this as a decision screen or a value screen?
I think it maybe can help us focus our conversation, our efforts, our decision making, because I think that, I'm thinking of the term of, how do you not, what is it, boil the ocean, or like, or how do you make good not the enemy of whatever that is. But like while we know the long, like while we want to do this big huge piece is going to require so much, it's iterative. And so how do we, be gracious to ourselves, and how do we also think about, like, in order to have impact, it's going to be phased, it's going to be iterative. And so rather than trying to take on more than we can handle or more than we can impact, it's like, let's start with, phase one, or let's start with this piece first and then build upon it.
Great. Other thoughts on how to use this specific value promote sustainable change to help us make smart choices, good choices, thoughtful choices?
I think of it kind of as using it similar to how we use the GARE tool and applying it to every decision we're making and every just every point that we're bringing up. Just, when we're looking at different changes in different projects, how is it sustainable? And so I think just applying what we've just talked about to all those decisions is really important.
Great. So kind of walking everything we want to put into that plan through it to make sure it fits. We have about 1 more minute, I think, before the room comes back together. Anything else from my folks online about promote sustainable change? Are we comfortable with asking our friend Anderson, even though there's been a shared document, to report out? Anderson, do you feel comfortable with that?
Sure.
Okay. I appreciate that you got it right into a Google Doc. That is a level of technical savvy that I'm envious of.
I started with Apple Notes and I was like, oh, yes, this is collaborative. I should share this.
That's perfect. Let me check in with our folks in the room. I think this is the time they wanted to call. I'll let them know we're ready. Okay. Folks in the room, can you hear me? Because I just got the message that you're ready. All right. Oh, I love that huge thumbs up. Thank you. That was very visual for me. So what I'm going to do is take us forward so we can see all 4 of our value screens because each group worked on one. And then I'm hoping my co-facilitators in the room can help. Each table needs to pick someone to do a little bit of a report out. We're just doing sort of 2 minutes. So it doesn't need to be any and everything you talked about, but the highlight reel perhaps of what your group came up with. And I think if it's all right, I'm just going to walk through in order to keep it simple. And that way, I'm not picking favorites because I don't even know who was assigned to what. So we'll start with centers, youth, and families. Anyone want to report out some of your thoughts on what that means, how to define it? All right. Hello.
Mom was gonna do it.
Youth and families over here, I don't need to see me. I can't see myself, but definition. Youth and family are valuable for their lived experience outside of system knowledge. Value. Need unique insights, positive and negative, and great tools based on real experience. How they kind of integrate into the SOCAC work. We have seats at the table, leadership, system working with people and not for them, in heavy quotations. Everywhere youth and family council must approve each step. Strategic plan. Create a systemic change. Use to make framework. Youth and family participate. Do not assume what people want. Ask them. Challenge the status quo. Do hard things. Have hard convos. And value different POVs. That's what we got.
I love that. Thank you for that and for the enthusiasm. That sets the bar pretty high for whoever's next. Who wants to talk to us a little bit about advances, equity, affordability, and quality?
I'm gonna move your sign over here so that I can see you and hear you.
So our group had an interesting conversation. We didn't follow instructions as well as the last group. We did our level best to respond to those. Anna is taking our words and putting them over here. So we started with a conversation around whether affordability is the right word, and maybe we want to talk about access instead of affordability, with the knowledge that we have to operate within reasonable funding expectations. That's, we can't design a system that is fantastic and gonna check every box we ever wanted, but costs $10 billion. Then we started talking about how, from an equity standpoint, a sort of a goal or a marker of what we're looking for is it's destructive of disproportionality. It's outcome oriented. It sort of levels, raises the bar on things like opportunity. The youth and families have decision-making power. And that on the quality side of this, we talked about a number of things, including we should have some knowable or measurable impact, that we're looking for linguistically competent, culturally responsive. We want to, preference evidence-based interventions when possible, and that it's relevant to youth and families' needs and strengths. So we can design this really great system that checks all the boxes again, but if it's not relevant to what youth and families are needing, wanting, saying, then we're kind of nowhere. So that concludes my report.
Great. All right, Friends Who Did increases awareness and reduces stigma.
All right, ours is over here. The handwriting. Number one, the thing that we put is that people know what they can get. They know what they need when they need it, and it's available to them. And making that kind of the the key sentence about increasing the awareness of what's out there, and then the ability to actually access it and not being afraid to access it. And then we felt like that was a good answer to number 2 as well. We thought that barrier busting and bringing people to the table, listening to people to find out what they need is a part of what SOCAC can do and does do well. And it's how we can fit that into the work that we're doing. And then how we would accomplish that is through potentially creating a really good communication plan and outreach plan, and to make people aware, not just to put this, once this is created, it's not just a plan that goes on the internet and never gets used, but is used at a statewide level and then also locally at system of cares as well, to help create a unified vision for what we can do in our state.
Woo, very good.
All right, online, Anderson, are you open to reporting out for us since you are such a great note taker?
Oh, shucks. Yeah. So we talked about promoting sustainable change, and how we defined it. It was something that you put into writing, like policy, that can actually be accomplished as a long-term commitment. It's achievable, feasible, and evaluates the cycle of change for calibration. So it's something that we continually look at and review to make sure that it's going in the right direction. When we looked at what does it mean to us, we talked about having impact with real outcomes, including accountability to youth and families served by systems of care. There's a high level of intentionality with resources, and it's transformational of the self and systems that are involved. There's also impact and awareness of that impact in the spaces that it's in. And then discuss this value fits into the work of SOCAC. It was so nicely put that SOCAC tends to be one of the more functional spaces to have these tough conversations and actually turn it into action. And so that is where that was. And then also just using the GAR tool within the plan to really hear everyone out and really think about where's the best place to put the energy with our various systems that we're interconnected with. When we talk about how we can use the value screen to help make smart choices, it was said that the value screen would be an iterative process to help take steps in the right direction, and to help make smart choices.
You cut out right.
So I'm going to ask the group, both folks online and in the room, what did people notice? What did you pick up as we were reporting out? I have a couple notes of things I've noticed, but I'm much more interested in what you all heard first. Thoughts and reflections on those report outs?
To me, the group really each highlighted bringing people's voices to the same table. And that would be both, I think, the voice of lived experience as well as the different professional voices brought to this table.
Yeah, that was definitely a theme I heard throughout also. Other thoughts or reflections on the report outs and what each group came up with?
I think that throughout constant, having different ideas on things, we often forget that we're on the same page more often than not.
Mm-hmm. Mm-hmm. Absolutely. I heard a lot of the same things coming at us from different ways. And in fact, my little, visual thinking brain was like, oh, this page shouldn't be 4 separate lines. It should be an interconnected web, right? Because these values actually interact with one another, overlap with one another. And it's sort of the web or the sieve we want to strain our ideas coming through. And that's really one of the things that stood out to me. Other thoughts maybe from folks online about what we heard? It was so beautifully done and so perfect. That's what I'm hearing. No comments to be had.
I think there's a general theme across all of them about access, and access isn't specifically spelled out, but it's obviously a strong current here.
I love that because when we talk goals next time, I think that's where we're going to bump and certainly in a second we're going to talk about what's missing, but you're absolutely right. Access came up repeatedly as something that's missing and we'll have to decide as a group, and I can't wait to get everyone's thoughts on, is access a value screen or is access one of the primary goals, right? Because that's where I have thoughts on that, but it's not my decision to make. It feels to me like, based on the conversations I've had, one of our goals is access. And then we have to run that through these value screens. But just because that's my thought doesn't mean that's where we land or that that's even right. And I just want to hop into the chat and call others really noting that we're really on the same page, right? So much of what we said was overlapping and similar. And how did it feel to have this conversation? Talking about values, looking at these values.
Very community centric and meaningful to me on the younger side of things. But it's great to be here with y'all and get a better sense of the people who care about the meaningful change we're trying to create. So I agree with everything. As far as values, we're trying to create the culture. Well, value screen and the goals, the separation plus how their intersectionality. Thanks for having us.
Ebony, do you want to jump in?
Yeah, I think it was just a good reminder that although we have important varying perspectives and realities, is that we are more aligned than I think that we realize. And I think, just walking through the exercise for me is just like, it's buildable, it's foundational, and, our responsibility is to create change in a thoughtful manner that's doable, that can be sustained, and, not always be in this state of kind of spinning to get to nowhere, because our responsibility in the end is to our, children, youth, and families.
Mm-hmm. Thanks for that, Ebony. I'm seeing in the chat a comment about inclusion and how everyone is bringing something to the table and how meaningful that is. I can't see folks in the room very well, so I appreciate you just jumping in if you have something to share.
Okay, cool. I don't know why I didn't realize that. Yeah, probably I have to do like one of these.
Just jump in. I'm so sorry. I should have been more clear.
No, it's okay. I'm like, public school has taught me not to jump in on people, and so when I do, I'm like, oh no. I guess for me, the conversation just feels very needed. I feel like a lot of people don't realize that they're thinking the same thing in a different font. And that having everyone either in the same room or in the same space with some people physically there, people can see and realize that there's actually like people behind decisions and, like human beings making these decisions versus like entities or ideas. I think it's very important that we're just having this conversation in general.
Did you just say thinking the same thing in different font?
I sure did.
I love that. I wrote it down. I'm going to borrow that. I will credit you. I think that's such a great way to capture what's happening. And I want to make sure I heard you correctly. But yeah, I appreciate that. And I think it can be really meaningful to be in the same virtual room or the same room and actually sort of move around together and be in conversation together about some of these foundational pieces. Any other thoughts from those in the room who I can't see who may be holding their hands up?
No other hands up.
No hands are up. Okay, thank you for that. All right. So I want to honor what I said at the beginning. We're a little ahead of schedule, so we've got a couple minutes, but I want to hear from folks about, is there anything value screen wise that's missing here as you look at these collectively? And we talked about access, and I'm gonna I have a big note about that, and it's circled and squared in all the funny ways. I really make sure I don't miss something, and I really want to revisit that when we talk goals and look at them together and think that through. So I've got access here as something that's potentially missing and requires a deeper conversation. Anything else in terms of not what we want to do, but how we want to think about the values we want to screen what we want to do with?
One thing that jumps out to me, I think it might be implied in a lot of the discussion we've already had, but to maybe draw a sharper point on ideas like community-based, that we're focused on things that help people in their communities, in their schools, in their homes, in their whatevers. So that was one thing, and I had another one in mind that I forgot. So maybe I'll remember it.
Community-based. I love that. That's definitely something that has come up, and I think finding the right place for it makes a lot of sense. And I think hearing the way these were defined and the conversations at least we had online and then the report outs, it does seem to me like there may be sort of a fifth value screen we want to think about, which is that community-based, community-driven, community-oriented. We can wordsmith that, but I appreciate that. We want to get the closest solutions.
Addie, I don't know
Sorry.
if you can hear me, but I laughed when Andrew said that, and I wanted to make sure I wasn't laughing at you, Andrew. I was laughing because the fifth one we had was something around building community care, and then we took it off, and so I was just like, we just decided to pull that one off, but like it should have been there.
That's right. I was thinking the same thing, Anna. Community care, community-based care, something like that, I think probably needs to go back in.
And I don't think it's possible to offend me. I think people have tried. The other one that I was thinking about was prevention. Taking as much upstream as we can, and to not always be treating things after they happen. That you can get really public healthy and talk about primary prevention, but that's difficult. But we should at least be thinking about secondary prevention, or something like that.
I love that. When you say that, is someone talking? I'm talking over them.
The amount of times I've heard the discussion of upstream intervention as like an important topic and then just getting dropped immediately could fill a book.
Yeah. I think a lot of people don't realize how important that is. Like, I feel like for a lot of essentially aftercare, after the things already happened, like calling the police, someone's already been shot, right? Like, I feel like people don't realize that if you can avoid the person getting shot in the first place, then you don't have to call the police. Then they don't have to go to the hospital. Then the person who does shooting doesn't have to go to jail. They can get the help that they need. And I think people don't think about that.
Everybody have a hand up.
I would also argue that part of the reason, I wouldn't say people don't think about it, but it's super hard to measure something that's not happening, which is like part of the struggle of public health research and stuff like that. And I always say this, but in public health, they say like, if you do your job correctly, people will think you were overreacting because you were able to prevent so much of it from happening. And so it's like a really thankless thing. And I know none of us are like sitting here asking to be thanked for the work that we're doing, but like, I just want to point out that it's super hard to measure, even if you are super conscious of like, we want to prevent this thing. And like, ideally, you could see like certain populations, like people in certain settings, like the number is going down, but there are also so many outside factors based on what's going on in society and insurance. As we all know, there's like so many different factors. So it's just like really hard to measure prevention. And that's like something that I think about a lot and care about a lot, but and think it's super important to prevent things from happening so that we don't have to treat them. But we're inviting that. Thank you.
I think that was great, and it's just going to add to that well said, Cameron. But also, even if we did have a plan for upstream prevention, we don't have the tools to measure the actionable progress we're making for the preventative side in place already. The tools that we talk about, that would be so, but we don't have the tools to measure it in the first place. So maybe a good place is to decide how we want to measure the metrics of upstream prevention as a consensus in the council. That would help us.
Thinking about how we
Happening at the ADPC, isn't there a push for primary prevention, like getting it all into one stream, understanding where the money's coming from, where it's going, what it's funding? That's happening over in like the OEA space, right? And like totally should be a part of this conversation, right? Like, Caleb and Cameron, that's the chairs of the OEA. They're raising prevention.
But we're kind of doing our strategic plan, and then also I know like ADPC has a prevention. They only have a few subcommittees or like work groups, and they have a prevention committee that's like I don't know. I think it's really important, but yeah, I mean, that's like how I got into public health in the first place. Is that I was little and I basically asked my dad. I was like, "What if instead of people like having to cure cancer, just no one got it?" And he was like, "You run with that. You're gonna you'll be rich one day. People are gonna love you. You know, like you keep thinking about that and get back to me on that."
I love this conversation. And I think talking about prevention is so important. And for me, where I see it, and this is like the perfect segue to our next meeting. So I feel like I should, pay you all your $20 for planting the perfect seed to move us along, is that when I hear prevention, and now we're talking about actionable and we're talking about measurable and what are we going to do and how do we build it in, that screams to me goal, right? That's a thing we want to be doing. And then when we look at promote sustainable change, prevention is like the number one ingredient to sustainable change in the area that we're working in, right? So that's sort of like the value screen that we're going to send prevention through as we build it into our plan as a goal, because we want to move towards it. So I'm putting that on my list as something that I want to reassess the goals that I'm going to bring to you all, which are just starting points, just like these are starting points, in order to have the conversation at the next meeting about, all right, here are their goals. Do they fit through the value screens, and what are we missing there? And that's where it feels like prevention fits to me. And if we get through the end of the next meeting and you guys are like, no way, no how, prevention is a value screen, everything needs to go through, then we'll switch it up. Does that feel?
Can I add that?
Please.
Potentially, we should also look at, and the word that I'm fixing to use is probably not necessarily the best word, but maintenance.
Yeah.
So basically, I mean, yes. I mean, it's not. I'm not really looking for sustainability. I'm looking for, so like for example, parents who are trying to, ensure that their kids have the medicine that they were prescribed, but something happens, whatever, and then there's a break in the medicine that they receive, or CCO decides that CCO decides, we're gonna change this medicine from you being able to get it to now you need a prior authorization to get it this year, and now that creates a barrier in terms of the maintenance of the conditions or whatever it is that we're treating, right? So that in itself could then lead to a crisis. So in a way, you can use maintenance to measure prevention, because if you don't have a parent who's frantically trying to figure out where they're going to get their medicine from, then you don't have a child in a family or a youth in family in a crisis situation just because they couldn't get their medication.
I love that.
Honestly, maintenance is a pretty. It may sound a little like, what's the word I'm looking for? Like
Off-putting.
It's one of those words that like when you hear someone say it about sterile, exactly.
Yes.
It sounds a little like clinical, right?
Yes.
But I
Got
feel
it.
like that's a good term to use because it's better than upkeep, right? Because there's so much that goes between like a situation starting and needing that aftercare support, right? There's so much prevention that goes into maintenance of just making sure people get what they need so that they don't end up in that situation.
I
love
that. It's a little different than sustainability, so I really appreciate you calling it out. And we did talk a little bit in sustainability about how it's not just getting it going and moving it forward, but it's checking back in and is it still working? Is it still doing what it's supposed to do? But that was more at the system level. And I love how you're talking about prevention and maintenance. I like the word maintenance, but I can understand why it would be off-putting in terms of being able to create a system that is supporting after an intervention has occurred in addition to preventing, right? So both those things. And that's a different kind of prevention in some ways because you're preventing the forthcoming crisis that would otherwise come. I love how you described that, Alicia, and I really appreciate it. And then I think just so I don't ruin the agenda, because I know we're having a good time, Anderson, let's take this comment and then I think I'll hand it back to our esteemed leaders in the room.
I'm curious if the word holistic matches that. If it promotes holistic change, something that includes that sustainability, but then also an ongoing relationship when it comes down to it. I'm curious if that is something that will be helpful.
I like that idea. I like the idea of thinking about sort of this both community based that came up, but then the idea of something that's holistic as a value screen, because that's definitely one of those values that we want to run through our goals, run through our objectives, et cetera. So I really appreciate that. And we'll come back to you all next time with some of these missing pieces embedded in the values and then embedded in the goals so we can look at how they crosswalk between one another. So I want to thank everyone for participating actively. It sounded like, from what I was hearing, the room was filled with laughter and lots of good cheer, which is nice. And I know we had a nice time online. So I appreciate all of you. Hopefully next time I'll get to be in person. I can't wait to sit at the same table as all of you. And I may even bring cookies if we time it right, because I really like to stress bake. So that can be to everyone's benefit. But I will hand it back to the amazing leadership of SOCAC, and thank you all again for your time and all this awesome information and these great notes. And don't worry, Christy took photos of every single white sheet. So I've got those big pages and all your notes and all your real handwriting to work from.
Thank you, Abby. Yes, appreciate you. Transitioning, next up we have subcommittee reports. I think I will continue to beat this drum that like a lot of the real work of this council happens in the subcommittees. Like, get engaged if you want us to keep up on everything that's happening month to month. For a lot of the real work's happening too. What's that?
Robin just said we need more committees, and I said I was going to.
Robin wants to chair more committees.
We need more people in the existing committee.
Why don't we have a committee?
Oh,
Hey.
I think I heard Jesus volunteer to the committee to think about more committees. So that is not what we're talking about today.
That'll be Tuesday at 2 a.m.
First up, in our subcommittee report outs, though, we do have the Oregon Youth Addiction Alliance co-chairs, Caleb or Cameron. One of you want to take it away, or both?
I can start. We'll both be. So. So creating a strategic plan, that's like our whole. Okay. Hello, can you hear me now?
Michael, could you move the one? Yeah, right there.
Is that better? There you go. Oh, there you go. Okay, I've been told I have a quiet voice before.
Wow.
Is that better? Hello? Yeah, it's good? Okay. So what's new with us right now is that we are almost done with our challenge statement. So basically, OYA is tasked with creating a strategic plan to address youth addiction in Oregon. I'm also looking at this thing like it's a camera, but so we're doing a lot of the same work that we just did together here, but specifically focused on youth addiction. So we're trying to get to like narrowing down some of our areas that we want to focus on. And then Caleb will tell you what our next steps are after that, but we're really excited to have laid down some of the groundwork and be getting started with some of the actual work and making of the actual strategic plan. Caleb?
Yeah, so excited to be here in person with y'all. Am I being loud enough, first of all? So our challenge statements right now that we're working on are for our buckets of work we've created for legal and carceral settings, mental health, co-occurring disorders and substance abuse, peer support, reduce stigma, and then recovery treatment options, as well as youth and family recovery spaces, school-based prevention category. And then we're in a conversation on how we can condense this work into more aligned work, since there seems to be a lot of overlapping themes in these areas on the need not being met. And so how can we have a youth and family centric approach, but not only that, a sustainable one, as we talked about. We've talked about the creation of some tools. On our side, we had a chance after the testimony in Salem regarding House Bill 3835 to have a few hours to talk about the tools we want to create on the well, that was the first one. I'm talking about the second. Anyhow, well, we also did House Bill testimony on 2502 as well, Salem, back-to-back weeks. Cameron was just in Salem and was able to testify too on 2924. So big to her for always, these youth really do go above and beyond. Just want to recognize the hard work and everyone else's as well. But that being said, short and sweet, I know. So the root cause is the next thing we're going to jump into. And now we have like the overlapping themes. And so we're going to jump into how do we meet the need not being met. Back to Cameron real quick.
Yeah, so we've also, Caleb and I have continued hosting debriefs for the youth. Just it's our time to like check in with them. And we now have our facilitators also in the space. One of our facilitators is a licensed therapist, so it's good to have her support in that. And Caleb and I are also learning and actively seeking out, gaining tools to be better at that role. And yeah, we've just been working with our facilitators a lot to be the best co-chairs we possibly can and make this strategic plan really work and work for everyone.
And the last thing we just wanted to mention, and definitely want everyone to know who participates from the system and care side of things, we really do appreciate your time and efforts on a Friday afternoon, especially I know it's tough to give up 3 to 5 or 4 to 6, but that being said, shout out to Annette for being a huge contributor in the OEI, and we'd love to see y'all in the OEI space as young leaders, and it really would mean a lot.
We also have Wednesday meetings too.
In case you got anyhow, thank you so much.
I got rehearsals.
Thank you, great job.
All right, he said his piece.
Caleb has left the room, but does anybody have questions for Cameron, I guess? Just gonna give a little bit of space for folks to get off mute online if they want.
People in the room can ask questions too. Just because you can't push a button to raise a fake hand doesn't mean that.
Everyone loves hearing feedback.
I'll add that Caleb and Cameron are really efficient at facilitating the group, making everyone feel comfortable and included. They're really solution oriented. So when they set a goal for that meeting in those 2 hours, they reach it. So, woo, good job.
Yeah. Right on. Okay. Family Advisory Committee, Alicia, do you want to share?
That's me, huh?
If you want.
Annette, I asked Annette and she pointed at you. So.
Well, okay. So we've been, Family Advisory Committee has been meeting a few times now on the first Wednesday of the month. What have we done? So we're actually in the process of creating our own group agreements. So we did the first kind of iteration of creating group agreements for that subcommittee. There have been some advocacy trainings that we've had put on by Common Thread and NAMI, right? So next step tomorrow, I believe we're going to be talking about, or actually finishing up group agreements, hopefully, and then talking about talking about what IDD or intellectual and developmental disabilities, intersectionalities of those disabilities with other backgrounds and cultures, and trying to kind of just have a frank conversation about how to reach families who are not very, who don't know about IDD. And if they do know about IDD, it's sometimes in some of our communities, it can come with a lot of stigma. And that's one of the things we really want to start spearheading to just have a frank conversation about. What else is there? What else do we do?
I think that's it, because when we talk about barriers, a lot of the barriers are people going into spaces requesting support and they're not giving it. They're not told what IDD is, or if IDD could be what their child is. Yeah. So I think the family committee is going to start those conversations on how to empower families to get the services that they need for their child.
Yeah, yeah. And I think one of two of the areas that we I know that there has been conversations about is definitely concentrating on the intersectionality of IDD in Black communities, and then IDD in rural areas. That's where we both see some of the biggest stigma and misperceptions and around that topic. And something else we talked about is how we show up in the family advisory committee. Whereas we have folks who are just starting their advocacy journey, all the way up to people who have been doing it for quite some time, and really trying to find that balance around how do we invite that kind of really diverse background of people and not make the space feel intimidating or not engaging enough, depending on which end of the spectrum you're on, and just how we show up as our whole selves without having to throw out all of our accolades and degrees and all the other stuff, but still be there as family members and caregivers who know a lot. Yeah, I think that's pretty much it, right? Yeah. Really? Okay.
Questions for Alicia or Annette? I have one.
Uh-oh.
Whoa. So we got to work on this. So, are you all still recruiting membership?
Okay, so that's one of the things that so we are in the process of trying to figure out how we recruit people in the best way possible without excluding certain people or including people over others, and creating potentially I don't want to say hurt feelings, but it's a process that we're trying to figure out how to do it in the most meaningful way. Because the idea really has been, we don't necessarily want to just have, a whole bunch of people with an IDD background or, a whole bunch of people with special education background. We really want it to be a group of folks who have all kinds of different backgrounds and understandings and perspectives. And the goal that I had for this group was to really make it a committee that is built by family members, rather than me or Annette and I creating this thing and then just having family members come to the table. We're like, oh, here you go. This is what we did for you. So we really wanted to make it, create a space that is created by family members. So we're in the middle of it. That's a non-answer. I know that, but.
I think am I understanding that yes, you are, but not actively yet?
Right.
Okay.
Yes.
Just want to make sure that we are sharing the information when y'all are ready.
Yes.
So, okay, cool.
We're also sort of kind of thinking about how, like, recruiting folks in family committee and youth council, like, oh yeah, like, we need to be able to, staff needs to be able to onboard them, we need to be able to train folks, we need to be able to, like, connect people with other folks who've been doing this work for a while so that they can have relationship and guidance, right? And I'm sorry to be a broken record on this, but, like, staff are at capacity, and so it's hard for bringing on new folks and creating a safe place at the table for them, getting the right chair that fits their unique needs. People have slowed on some of our recruitment because we just really don't have the capacity to be like, oh, I'm in the door, like, yeah, this stuff's set up for you. But it's still happening because the work, it's like if you build it, they will come. People are hearing about the work and showing up at the door and asking if they can come in and sit at our table. So I just felt like that was an appropriate time to say, we need to have staff on these bills that we have in the legislature before we can really start expanding even further than.
Yeah. Yeah, I would add that has been a very important piece to this process is, if folks reach out to Joylene and say, hey, I wanna do this. And Joylene is like, okay, cool. Now that means I gotta do an orientation, right? So now we have, like Annette and I think we're really trying to be part of those orientations as well, to just start creating those relationships with new family members and caregivers who do want to come in. But still, right, Joylene is still having to lead that part herself already. So yes, very important to have people like Joylene on the team.
So I will then say, good problem to have. Credit to young folks, families, Joylene, the rest of the team. It's good that people want to be here. And so, credit to you all. And yes, let's try and make sure we solidify those staffing positions and get what we need to do that well. So, okay, cool. And Alicia's walking away from the table too, so we're not going to have any more questions for her.
That's a mic drop.
Yeah. Noticing a pattern. I'm gonna now go to youth council. So Jesus or Zafir.
I gotta figure out what I'm gonna do once I'm done talking. Hello. I have missed the last few of these, so a lot of what I say might be regurgitated information, so bear with me here. Youth council has had a lot of its kind of like weird, busy, not busy environment where we've had some people wanting to come and say things to us and ask things of us, and then we push something back saying we'll get back to it next month, and then something else comes up next month, so we push it back again, and then we realize 4 months ago we were supposed to work on something that we hadn't worked on because we've been talking to people for so long.
Yeah.
So right now, our area of focus, because I think we have a little bit of breathing room for a while, is working on like solidifying kind of our core values and charter. And then hopefully nothing pops up in between there to make us push it back another 6 months.
Oh, it will.
But that's kind of where we're at now. As stated before, getting new folks in the door has been a bit of a subject of contention because there's just not really capacity for it, as well as, we have, solidified our application process and integration process. But again, going through that with someone new with the amount of workload that it takes, it's just kind of not really feasible. But from my understanding, we still very much have people that are interested And we still very much get people that want to talk to us about things.
We've had new people that have either shown up or like should technically be members by now, but it's just been like, ooh, we should have
applied.
Yeah, that's true. That is true. That, it's been a little bit of a mess, but when is life not a mess?
Every couple of months we sit there and we're like, have we done a new application review? And then we sit in silence for like 10 minutes and then we move on to the next topic. So
You see someone crying off camera for like 3 minutes. Not actually.
It's fine. I think things are going steady. Obviously, y'all heard from our wonderful folks here who also chair their own committee and are awesome and amazing. And make me really insecure about my work. They've been doing a lot of like legislative stuff and testifying and just being really present in all these spaces. So that's wonderful to hear. I think we have a really good group of amazing professionals, like Michael, who's now here sitting with me in this very big lonely youth chair. And we're trending in positive directions, as much as it is difficult to feel that way in systems work.
Trans kids of color, we're coming back, baby.
We're here.
I think right now our main focus is working on our panel for, I forgot what the conference is called. It is next week. Next week, baby, because we were supposed to work on it a bit ago. And again, stuff kept coming up that was like, this needs to be done by this. This doesn't need to be done until then. So all this stuff had to get done. And now we're like, oh no, that's a month. We're out a month. And so a couple of things last week, I kind of was like, okay, we're doing this. We're putting the presentation together. And it's pretty much done. There just needs to be like small adjustments to it. But it's pretty much a Q&A panel about trauma-informed care and how that intersects with youth in policy style systems. So if anyone wants to see our thing, you can come. I mean, I won't stop you. Once I remember. You guys should all come. It'd be cool. I'll be loud.
Okay, I think I was supposed to register you, and I didn't.
I went ahead and did it.
For free? Okay, well then I think I owe you $170 because I had a free ticket for you.
No.
Awesome. No,
I can't. I did it on my own. I got you.
All students are registered, and y'all have hotel rooms.
Registered voters.
Is anybody else wanting to go that didn't get a ticket?
We can vote.
We still have free tickets. Anyone want to go to the Alliance Conference that doesn't have a ticket? We still have 2 free tickets to the Alliance Conference.
So it is next.
So it is like next week.
Wednesday, Thursday, Friday. So it's like Wednesday afternoon, Thursday all day, and there's a session in the morning on Friday. It's at Salishan. So it's at Glenadin Beach at the coast.
And you're going to want to see the Wednesday panel because that's when our youth are talking about what trauma-informed care actually looks like and feels like to youth who need it and not what it reads like in a book.
You should go, y'all. I put a whole presentation together for this, y'all. Come on, y'all.
You also don't have to. That way I can pretend I don't know anybody in the room and feel a lot better about
No, I want to go there.
I think y'all please show up.
Well, if you want to, what?
Yes. So System of Care has a couple of, I guess, free, opportunities for folks to attend. So if you do have interest, talk to Anna. And yeah. Okay. Questions for Youth Council? Before they walk away from the table. And there. All right.
Yeah.
Okay. So we're going to call it then for Youth Council. Are there other committee reports?
At least I didn't leave the room.
Oh, can y'all?
Y'all are too much, and I think this is just a sign of like how maybe nice it is to be together that we're able to do this.
Can everyone hear me?
Oh, question?
Can everyone hear me?
We can hear you.
Oh, this is Ebony. Anna, should I give an update on the state agency standing committee or?
Sure.
I mean, and then Anna and Chelsea helped me out. But basically, I think I'm the new co-chair. I've been in the role for 2 meetings now. And basically what we're focusing on is, kind of solidify and confirm previously resolved barriers so that then we can be in a kind of focused and action-oriented state to then delve into really being able to define what does resolve versus complete mean, just so that we're not in this perpetual cycle of, having this cloud over our head, feeling like we can't see change, impact, and then, helping us be better positioned to really understand, where are the levers that and decisions and, influence and authority that we have versus, this is really a legislative issue that we have to bring forward, so I'd say that we're kind of in this place of resolving to get to a place of resetting. And so it's my second meeting. And so Anna, I don't know what you would add to that.
That sounds great. I got nothing to add.
Questions for Ebony? Oh. All right. Anybody else?
Very inquisitive group today.
All right.
Questions of crochet.
Then I think we can transition just a couple minutes early to our next topic.
Right. We have our illustrious legislative chair. Here, she's going to give us a legislative update.
Well, so this morning was the hearing on council composition, and everybody needs to give a standing ovation to Cameron, who knocked it out of the park. Knocked it out of the park. Your testimony was fantastic. Jesus, your testimony was also fantastic. Sorry, kidding. Jolene did a lovely job reading.
Literacy.
Seen those. So we had our public hearing today. We will have a work session Thursday? Work session Thursday. We should go down to Ways and Means, where hopefully everything will be good and we will get our 3 staff positions and all will be right with the universe.
Yeah. So just to be clear for folks that maybe aren't as deep in it or guests today, that would add 2 youth to the council and also 2 additional family members.
Who's joining? What? You mean not everybody reads all the bills all the time?
Correct.
Contrary to popular belief, I feel like a lot of people don't read them.
What?
Yeah.
What do you mean? I will read them. I read them.
I go create giant summaries.
Double the payment fees and double the fees is the same as what we have, just twice as many. So we would have 4 family members and 4 youth members. And in our reading of the language, the way that OHA had sort of read it, and when Senate Bill 1 was passed, it was like you need a kid who has DV experience and a kid who has JJ or juvenile legal experience. The way that we read the bill is that it's an or. So any of those seats are open to anybody with those experiences. Michael.
Hi. What do you mean by kid? Are we talking like 0 to 17 or?
0.5. A young human.
Thank you.
I'm sorry. Okay.
Young.
I need a baby goat, actually.
You just
I'm okay with that. I'm okay with being called a baby goat.
Got you.
So I just saw in the chat, Sonia said that we lost audio for a minute.
Aww. I wonder if he's chastising Anna.
It's
back
now, but it just went out for a little bit. Okay. Do you know what you missed?
Did you catch the? Yep, I heard. Yeah, okay, Emily. 2 additional youth. Yes, 2 additional family. Okay.
And then those are the 3 staff.
And the
So
3
that
staff.
would be Jolene's positions, permanent funding. It would be taking Corinna's position from a limited duration to a permanent and also funding it. And it would have a public affairs specialist who would be our system of care advisory council comms person.
Yeah, that's awesome.
Sorry, I just can't help but talk about
It's all good. It's all good.
Any questions about 29, 24 before we let Robin go on to the next bill?
Just to reiterate, in case you missed it, the youth seats aren't required to be one or the other. They can be both or either. It doesn't have to be 2 juvenile justice, 2 lived experience.
Yep.
And I'm not sure what the criteria was for the family seats because I only read the youth seats.
So it's kind of the same.
Me and Jesus both have twins, so we know where we're going.
I have a question that's like not super related to this, but is there anywhere that like defines what a juvenile justice experience is?
Yes.
Has been involved.
And we took it out. It was very specific in the legislation. It was adjudicated youth, former adjudicated youth. It's all defined in statute, and then in rule of what that qualifies as. It's a young person who has been either found guilty of something or has received services through like probation and parole or something like that.
And they also had a thing for wards of the state, right?
Yes.
Needed
Yes. This is also taken out now, yeah. Because that language was stigmatizing for youths.
Sounds like a war crime.
We also had, Alicia brought forward a proposal around, the compensation issue that we couldn't put into the bill at this stage in the game, but we are meeting with Brandy Hemsley tomorrow from governor's office around this issue tomorrow. And hopefully, I was kind of hoping that we might, it occurred to me the timing's not going to work to have a report on that at the Ledge Committee. But if you want some time tomorrow morning at the Ledge Committee to talk through the proposal before we talk to Brandy.
No, I think we probably need to talk to Brandy first to see what, make sure, clarify things and make sure we're all on the same page first.
So I see Emily Cooper, you got your hand up. I saw you put it in the chat, but go ahead.
I'm also now sparing you all my snotty face. Robin, you mentioned the composition issue that Alicia brought up. What's that?
So it's about compensation. So in order to pay youth or family, there is some law that requires an individual to make less than $50,000 or a house, I think it's a couple, less than 80.
Less than 100.
Less than 100. It's 50 and 100.
Yeah.
And so, let's be real, right? If an individual makes $52,000, why should they not be able to receive a stipend?
Right.
And so we're looking at, Alicia brought it forward as a concern about equity, right, and discrimination. And so I think that she's got a fair point. And so we're talking to the governor's office about, can we change the law to raise those amounts?
The area median average right now is 75K for a single person. And,
really?
Yeah, 100K for a family.
So that's the proposal that we sort of started to float is 200% of AMI or area median income. So that it would change over time as wages change over time. And so right now it's just set in law 50 and 100. So no matter how the economy changes, it stays at 50 and 100.
50 hasn't been the AMI for like 7 years now.
Yeah.
And it might have been set back then. Like, I don't remember when House Bill 2992 passed, but that legislation applies to all of the councils and commissions that provide stipends, and there are almost 300 of them. So we didn't also feel like it was appropriate for us to try to make that change to 292.495 and affect all of the councils and commissions without having a broader conversation. So that's what the conversation with the governor's office is to sort of start out what would this look like and what might be possible.
Yeah. Thank you for bringing that up, Alicia. I didn't even think that was a possibility to talk about.
Oh, see, I throw things out all the time.
You don't get anything you don't ask for.
Listening is the other part.
I want $1 million,
but
$1 billion.
Yeah, do that. But no, I do appreciate, everybody involved, bringing it forth and bringing it to kind of the people that need to hear it. And, to me, I just thought it would be something as simple as identifying what's a qualified member versus a non-qualified member, and then saying that, hey, if you have the money, you can still pay a non-qualified member, right? So having that conversation with the governor's office, I'm hoping we can identify which route we can go, which is the most feasible one, and then definitely, making sure that we're not inadvertently discriminating against folks who, happen to make a little bit more money.
It kind of reminds me of like the laws against like disability, how when a lot of people with disabilities like make a certain amount of money or get married, then they lose access to their disability rights.
They can't have more than $2,000 in the bank at any given time, or else they don't.
Yep. It's like, it's designed to keep you within the system.
Some people with a disability want a house.
Which is so funny when people complain about people with disability, like they have so much money. It's like they literally can't have more than 2,000 at any given time.
Yeah, and if you do, like, you cut off, period.
Yeah.
If you make $1 over the amount that you're supposed to
And
make.
if you don't tell them, then they can't get it in the future.
Exactly. You lose your SNAP benefits and all the things.
You eat one extra meal a month and you're starving for a
How
week.
dare you eat?
Ludicrous.
Yeah, so it really is shifting that mindset, right, of like the kind of Clinton era, right? Changes to, different welfare programming and that sort of thing that still lives all over the place. Yeah. So exciting conversation to have tomorrow. Thank you, Alicia.
You had something you wanted to say, right?
Again, thank you.
You were in the middle of saying something and then.
Oh, no.
All right.
I'm good.
So Robin asked me to take the update from House Bill 3835. That is the omnibus PHS SOCAC bill, which is now named Act for Kids or Access for Kids and Treatment for Kids. That bill has a work session tomorrow, which is Thursday, so right, at 8 a.m. In case you aren't doing anything, go ahead and tune in on OLS and watch. What I expect to see is that they will adopt the -1 amendments, which are that second round of amendments that came from the legislative committee, from our folks with lived experience, from our partners that were all accepted and adopted at the legislative committee meeting maybe about a month ago. I expect that they will adopt the -1, so that means that they'll edit the bill with all of the edits that exist in those -1 amendments, and then move that bill over to the rules committee, which is a House committee, but it does not have the same chamber deadlines that all the other committees do. And I expect a third round of amendments that will come in House rules. And I don't know if I should broadcast what those amendments probably look like or not. Those amendments are not SOCAC amendments. Those are amendments that the bill runner and the committee chairs are trying to make more sausage to get the bill through the building. That I don't think I don't think they're going to harm anything, but it's not going to be the full package, the full meal deal that we had all put together, and that's how the game is played, y'all. So happy to take questions on that, but that's the up-to-datest information that I have.
Up-to-datest.
You said like 7 quotables in that like update you were giving, and I want to say that's a new personal best.
Yes,
You're doing
talking is my
wonderful.
best skill.
And for those of you who are playing along, we do have a legislative committee hearing in the morning, or meeting in the morning, if you're interested. And Senator Gelser Balloon is going to join us at 9 a.m. ish to discuss her bills. So if you're interested, come. It may be a little light during that 8:30 to 9 a.m. You may get to watch us vamp a little bit because we don't have much to talk about. But right around 9 a.m., Senator Gelser Balloon should be joining us to discuss her bills.
And then Senate Bill 1197, I don't know, Christy or Adam Peterson, I'm happy to provide the update, but either of you as the respite committee chairs might also want to say something.
I can start with what I know. So the Respite for All bill really became pretty expansive to include most youth with any sort of a need for respite in the state would have access to it, regardless of insurance, regardless of really what systems that youth were a part of, and as long as there was a need for respite and the ability to provide it, that folks would have access to it. When that came back from Christy, where did it go and who were the folks?
The table.
Sorry. When that idea was passed, it it came back with a very high dollar amount attached to it because it basically then became a state benefit that people would have access to, and that all youth would have access, making it very hard to actualize. And that
Right, I mean, they wanted like 80 staff or something,
Yeah.
right? Like, just because they're gonna need folks at ODE to like make sure that after school respite was a thing, and DHS and OHA, right? So it's gonna be prohibitively expensive.
Yeah, so that required us to kind of pivot to say what could we accomplish with this go round, and it looking at what we have the levers to do things with, and it then became looking at Oregon Health Plan and the ability to impact you all, making it kind of a statewide available resource for youth on the Oregon Health Plan, regardless of CCO coverage or fee-for-service coverage or open card, and really limiting the scope to that to try to make that be the focus for this go-round while we continue to build the system out. Is that reasonable? Okay. So that's the latest on the Senate, or on Senate Bill 1197.
And we need people to testify, right, Christy?
Yeah, so there's a hearing scheduled for next Tuesday morning, 8 to 10. Senate Committee on Human Services.
And Human Services.
So is anybody interested or available to provide testimony? We're trying to put together a panel. Anna is going to provide a few remarks, and I'm working right now to see if anybody from DHS is able to share. I'm lining up some youth, maybe some family members.
I have worked on testimony. I can verbally commit to submitting testimony. Absolutely.
Awesome. Thank you, Caleb.
Is that in Salem as well?
Sorry?
Is that in Salem as well?
It is, yeah, but you can do it online.
Yeah, I can send something in or do it online. Could you send me the bill?
Yeah.
Yes, we can send you the bill. The bill that is currently posted does not include the amendments that we've proposed, but I'll summarize kind of what we've asked them to change. I don't know if the amendment's going to be posted before the hearing, but they're working on it.
Sweet. Yeah, sorry, I can,
Okay.
formulate my thoughts better.
Awesome.
Instead of like, I support for.
Yeah.
It's great work. So good job.
Thank
It's
you.
great to see it and going into
It
session.
is harder to get our agency friends to testify for this bill because it's not in the governor's recommended budget. And so folks have to get like a special permission from the governor's office if they work in an executive branch agency to come in and support something that is outside of what her initial budget is. Just in case you're wondering why we're trying to get over to DHS. Like usually they're like, they've got our vaccines showing up, but there's a procedural reason why we are trying instead of guaranteed.
Good old red tape.
Yeah, for real.
Maybe not a quick question, but what is respite as defined in the bill? There's so many different versions of what constitutes.
So providing break for both family, parents, caregivers, very broadly, as well as youth who need a break from whoever.
Growing up.
Well, so the amendments are basically taking out, basically updating it to where it only includes children and youth on OHP, right, or Medicaid. The bill was originally, the bill that's posted in OLIS only refers specifically to CCOs. So that is being taken out and just referring to Medicaid eligible, regardless of whether it's CCO or fee for service. There's a reference right now to only being available to unpaid caregivers. We've recommended unpaid be taken out. There's a couple of other recommendations we've made that haven't been posted yet. Okay. Then I think the name for the bill is a little bit of a misnomer then. If we're talking about respite for all, when it doesn't include respite for all. Yeah, I don't actually know where that respite for all came from, to be honest.
For most.
Is it respite? Not, I mean, I, not that it's anything bad, right? Like, I don't wanna
That's a fair statement, though.
disparage.
Because all means all and most means most.
Right.
Right.
And I think some of what this comes out of is there are places in the state where this is not a resource for any youth.
Right.
And that even for youth who are on the Oregon Health Plan or have a coordinated care organization, that there is an inequity there where some CCOs provide this, some don't, some have access to it and some don't. And so the goal would be to at least create an equitable system amongst Medicaid youth to then be able to hopefully expand it after that, because right now there's complete inequity even within the Medicaid system.
Maybe respite for all part one?
Yeah.
I feel like
I mean,
that.
the way that I am at least interpreting it, right, is it's creating the avenue for everyone to get access to it. It's not like giving everyone access right off the way, it's just creating a door for it, which under that, sure, yeah, the name works. And I know we're harping on the name a lot. I'm sorry for that.
I just feel like.
Change the name on the slide.
You know,
I just, from my perspective, I'm like, some people will have an issue for a bill for any reason. And I feel like sometimes if the name of the bill isn't correct, then they're gonna be like, actually, it's a lie.
Yeah.
And that kind of takes a step back from what the bill's trying to do. Like, I feel like not giving someone a foot in the door at all to be like, actually is the way to go. Yeah. Yeah.
You know, I think I've screamed ad nauseum about the importance of getting started anywhere and how just holding things back for the hope that we'll make it perfect at some point is more detrimental than not even talking about it in the first place.
It's very ignorant.
So I think this is a great step in a positive direction. I'd argue a bigger step than we have probably made in a long time.
Yeah.
So yeah, I here for it.
Question, do we have a fiscal on this bill? Do we know what it is?
We do not.
Wait, didn't we get one with the 60
We got-
staff-ish
Yes,
folks?
we got one, and then we are submitting amendments and
Okay,
pulling it back.
I was just,
What was the one that you got?
It was huge. It was better than no. It was like, this is astounding.
Would it have basically killed the bill in its tracks?
Yes.
that's why I'm asking. I mean, because the way it reads, it doesn't go into effect until the federal government approves it. Which, because they have to contribute the FMAP part, that part of the rate. So that's a whole other thing. But I agree with you, Jesus, that starting something is critical, and let's try to kind of keep the train rolling. But I do worry about the cost and the federal approval.
We're trying to get it to where it has 3 OHA staff. And it's the 3 that they think that they need to get the approval and to get the state plan amendment approval, like you have to draft it, it's negotiation.
Yeah.
They need to do some rule set writing around how to, Dan's point, what does qualify as respite, what would they reimburse for, and then they have to create codes.
Yeah.
So that it's billable, so they need, and it's not like one is the coding person, one is the negotiator, but they need 3 people to get on. So that's what we're hoping we can get it back to, and then, I mean, if Medicaid doesn't fall apart, we'll be able to get a federal match and start rolling this program out, probably in like 2 years, realistically, it will take that, so I think one step that would be.
I mean, just 2 years
And
is
to
nothing
be-
in the grand scheme.
And to be fair, I mean, not to be fair, oh my gosh. You're doing great. And to be honest, oh my goodness, when I wasn't like proposing that like we like not support this at all, right? Like that's not what I was saying. I just wanted to make sure that, we don't have folks thinking that, oh, we already have this respite for all thing when, 2-3 years down the road, we have family members who are on a commercial health plan or Champion TRICARE, right? Saying that, well, we don't have access to it, but then, you have lawmakers and folks working in the system saying, no, we already have it. Like, you're good. Just, apply for it or do this, do that. And in the end, it's like, no, because it's only for. So that's why I wanted to make sure that, we have those
children, youth, and families also kind of in the background, like, you know, like Jesus was saying, you know, we're starting somewhere. But just making sure that we continue to remind ourselves that it's just a start, not the end all be all, if that's the goal here.
You know,
Well, I don't know if Christy and Adam have told you guys about it, but in other states that really have achieved something closer for respite for all, they have like a really, most of those states have pretty functional like work groups that are pushing this as their primary topic. Across systems, they have like a backbone organization that's kind of leading it or steering the work, right? And we don't have that in Oregon. SoCAC has sort of tried to pick it up and be that as one of our 77 projects. But that's not as effective as having one body who's just focused on that and keeping that ball rolling forward all the time.
Yeah. Yeah, I recently discovered that ODHS APD used to convene the Respite Coalition for the states. And I was messaging Angela Lead about it because I was like, wait a second, what was this? And it was a program that got cut at some point, so is no longer. But yeah, Oregon seems to be a little bit of an outlier in terms of not having a statewide respite coalition.
So what I'm hearing is, you know.
Well, we have the work group, which
Great work group.
it is a great work group. Yeah, I think we're having a lot of fun. Check out the video. If you haven't seen the video.
Oh yeah, you like to tell video.
Maybe see the video?
Video of the chat. I did.
No, distract you.
If you haven't seen the video, you can watch it. It's in the chat. And also, I think it's on our legislative action pile on our webpage, right, Corinna? Oh, and speaking of that, our friend Andrew Grover asked us to submit a letter in support of Top 112, which is the Family First Prevention First Services funding match. And that letter was submitted today on behalf of.
Thank you. And we also submitted a letter to Ways and Means in support of the
Tenzi's Law,
Thank you.
which is the expansion of the paid care and caregiver program that passed last session.
Yes.
With only enough seats for, I think, like, I can't remember, 300 families or something, and this would expand it to a larger group of families.
So we've been busy.
Is there a House bill for later school start times?
I don't know.
Can we work on
Haven't
that?
been
Oh, wait, no,
paying
I'm not school
attention to
anymore.
Yeah.
I think there is. I think there is.
If there is, I think we should consider.
You wanna,
Yeah.
you wanna talk about it? Let's come tomorrow, we have a little bit of extra time.
Do school starts nowadays? Like 8?
It depends. Some are like, some are 8.
This bill.
I mean,
How do I
see?
what's I don't know.
I mean, some of the kids when I was.
What's the justification? What's your
One of my GAs.
I'm at.
Like, I don't even wake up at 7:30 nowadays. Like, I'm lucky if I get up.
Hold on, hey, sorry, too many conversations, right? We have a hybrid meeting, so I'm sure that is, if it's distracting for me in the room, I apologize, but I'm sure it's hard for folks virtually to hear. Kyle, go ahead.
Christy was asking me what the justification might be for supporting that bill, and I only just recently heard about it because somebody forwarded it to me from another state, sleep physician. So I have training in pediatric sleep medicine or sleep medicine in general, and there's been long now a movement for later school start times for kids because there's very good evidence base for doing so based upon biology and the fact that adolescents delay their sleep onset time and wake time. And so it's doing so is very in line with biology over the course of puberty. And now there's evidence from other states that making these changes can lead to improved functioning of kids, less depression, lots of improved outcomes in making this change. I think the proposal is no school would start before 8:30 in the morning, which is
amazing.
In line with the American Academy of Pediatrics makes its recommendation.
That's the second session it's been in.
Cody was quick on the chat. HB 2359 is the bill.
Yeah.
So thank you, Cody, for digging that up.
Is there an age specific? Sorry, to cut you off.
Oh, no.
Because Portland Public Schools already has multiple different start times for children depending on the grade that they're in.
So I'm just curious if there's also adult work times pushback as well as part of this.
There is, yeah, that isn't a problem. There's a number of pushbacks, including athletics, it's a big change. Yes, it's not as important for younger kids, school age kids before puberty will wake earlier and go to bed earlier, but then
Right. Once you get
once you start,
Yeah.
that
I think they have a 9 a.m. start time in Portland.
they do for most of the high school. I think this is statewide and trying to make it.
It says,
I was in high school.
any district school board may fix the year and hours, the days of the year and the hours of the day when school shall be in session, except that, this is the new part.
Yeah.
A school with any grade from 9 through 12 may not start regular instructional hours at any time before 8:30 a.m. unless it is a rural school as defined by the State Board of Education.
So this would only be for high school then?
Only
except in rural areas.
Do we know why it's in the rural park of it?
I'm guessing because there are lots of schools that are broader than 9 through 12 and bus schedules in smaller town, like we only have so many buses in the river, and if you change the start date, you need to buy a fleet, and that's tough.
Other states.
I'm aware one of an individual that I went to high school with at our high school is now the superintendent of that school district. And there is one bus route, K through 12, right, picking everybody up. And it's tough for them to even find drivers for that one bus route that heads that way. And so I think that's a logical carve out because of that restriction. But
What was this
I have a
bill?
question.
Cameron has a question.
We're also thinking about like out in like places like Eastern Oregon where you have lots of farms and like farming families and agricultural families where they get up early anyway. Like that's kind of
Culture of the
exactly. It's kind of sort of a culture, and even on this side of I-5 where you have folks, you know, in those states like up there. And that's across the board. So I think.
Yeah, I have a question. It's like, I remember when I was in school that like, I think elementary school started at 8:30, middle school started at like 9:15, and high school started at 7:45. And they like staggered all of them because they didn't have enough buses to accommodate every single school starting at the same time. And so like, obviously all of us high schoolers were like miserable being at school every day at 7:45, but
couldn't you like stagger?
and we were like showing our teachers, we're like, see, like, look at these studies that say we would be so much smarter if we went to like slept in longer. And they were basically like, okay, well, like we don't have the money to buy more buses or hire more bus drivers and stuff. So I don't really know, like, I hate just like bringing up problems, but that's like a question mark I have about all of that.
Yeah.
Feasibility of it.
Feasibility is good.
Grad school.
for kids, students, yeah.
So we can maybe talk about it tomorrow at lunchtime, if everybody who's interested in this bill, or, we have some time at lunchtime tomorrow morning between 8 and 8:30 and 9. I know Cal can't make it, but,
Maybe at 8:30, 8:30 to 9.
oh yeah, it's 8:30 to 9. At 9 o'clock, Centerville School will show up. And we're
Bye, Caleb. Sorry we didn't.
So if y'all are interested in more topics, more conversations about House Bill 2359, come to lunchtime tomorrow morning. And I think it's break time.
It is break time, so we have a 15-minute break. When we get back, we'll do public comment, so break until 2:45.
Right on. I got no work done.
Yes, we should.
Right.
And can we back?
Ugh.
That's all right. So this meeting is being recorded and we are back. And it is time for public comment, so I'm gonna open it up. As always, you can see there on the slide as well, feel free to privately chat Joylene, Alicia, or Annette if you want someone else to say it, but otherwise I'll open it up for public comment. Raise your hand virtually or jump off mute and go. Well. Anybody?
members of the actual public here, but. Don't need the people. Now it looks like we have some local coordinators, if any of them want to chime in with some updates. They are also technically.
Yes. Hearing none, I will say something, since we got the time. I'll give just a personal plug that Rimrock Trails, which is in Central Oregon, they do youth substance use disorder work, is having a fundraiser this weekend in Central Oregon, Friday night in Prineville at Wild Ride, which is a brewery slash restaurant. I know it's a little like substance use disorder, but there is, it's for individual Kiefer, Kiefer Magic. It's his birthday bash. He is no longer with us, and so he was an employee as well at Wild Ride, and so Friday in Redmond, Friday in Prineville, Saturday in Redmond. There are fundraisers there, so I'll be there Saturday. Gobi is a sponsor professionally as well, and so I know some of our Gobi folks will be there in Prineville on Friday, but I'll be at the one in Redmond on Saturday. So anybody from Central Oregon or is over in that area wants to join us, love to see you. Any other public comment? Yeah, benefit for youth with substance use disorder and Rimrock Trails, which does great work. So hearing and seeing no other public comment, guess I'm going back to it.
Right. We're going to have another team building exercise. Anna will lead us through a small group team building exercise, taking advantage of our mostly in-person meeting to build connection, relationships, to sustain our work moving forward. Anna?
Thanks, Annette. Ms. Corinna, can you work this through with the folks online? Or somebody else? We talked about somebody, one of the staff doing it. So you should, oh, Jesus has them all. Some note cards that I meant to pass out. No, it's fine. You should have them.
I'm so sorry. I stole them.
There's some note cards. The mine. For you at home, you can use it for whatever. Write it down. I get to use my cool pen. Oh, sorry. Oh, you felt me.
It's for this purpose.
In case you want to yellow one.
I'm just kind of is this.
All right, so the reason why we are doing this is because all of us, as we affirmed at the very beginning of this meeting, are real humans who are here doing this work because we care, because we have a connection, because someone we love has been impacted by the system or wasn't impacted enough by the system. And I think sometimes we forget that everybody has a soul behind whatever their job title is. And I want to do something a little bit more hard hitting, but I think that some folks are, not all of us, kind of in their feelings right now about some of the ways that things are going with our work. And so just to remind ourselves that we are people and so are you, we're going to sit quietly for a little bit and write down on your own sheet of what helps me feel included when I want to be a part of a team. What is one thing I need to do my best work? And that may not be your best like paid work. That might be like what I'm proud of, right? Maybe it's my best crochet work. Maybe it's my best writing when I'm writing creative writing, whatever that thing is that makes you feel alive. What is it that you need to be able to do your best work in that thing? And what is something small that makes a big difference in my day? And then we'll break into small groups. It's the 2 people on either side. So 2 people, maybe 3 here, 3 there, 3 there. Us 3 if you want to talk to me, even though I'm staff. And Corinna, if you can break them into small groups online. Yeah, small groups of 3. Just write your thing down. In a few minutes, look up and discuss it. And then we'll share out like what comes up for us. And then we'll go home early And get home before traffic starts at Portland.
No, we'll get another pay done.
Sorry. Any questions before we get started?
Yeah, do you all validate parking?
We will for you, yeah.
What does that mean?
Oh, ask at OSBH.
Yeah, OSBHA will pay for your parking. For real.
I just was texting Patty about this.
It means pay for your parking.
Okay. I've only had a car for a couple months. I don't know what this means.
Yeah, because your first one got stolen.
Yeah, it did.
Did they ever find it?
They did find it and it was, well, it was drivable. But it was like,
If it
no.
makes you feel better, I told my car. So
That does not make me feel better. Flip, yo.
it was an old lady stole from.
Hey, distract files. Yes. Hi.
Last word in the third one, difference in.
My day.
Okay.
Two-minute warning.
No.
Corinna, if you wanted to, you could put Allison, Hillary, and Sonia in their own breakout. Give them a sign. Allison, Hillary, and Sonia. Oh, and then we have housekeeping. I'm sorry, we can't go right away. We have a little bit of.
There are some people already.
I see Carissa, Ebony, and Emily. That's why I was like, the other three who are really only online can go into their own other room.
What's the rest of the third question? Join a breakout room is upstairs.
In my day.
Okay. Oh, and copy.
Oh, Kathy. Assigned to room 3. Now everybody at least has somebody to talk to.
Yeah.
That will help them feel included.
That's the whole point. There we go. Dan's really seeing through this exercise. Okay, so now you can just break into your small groups. Talk about what you wrote down, talk about what came up for you, talk about why we may be doing something like this in this space, whatever you want to talk about. The point is, talk to each other.
I'm talking to you.
You three should split up, because y'all know each other really well.
Wow.
Do we?
You come to this meeting.
Yes, we want to mute.
Made us move. This is gentrification.
Coyote children.
Hey, folks online.
Thanks for sharing.
I don't know what that was.
Thank you, guys.
We're calling you back. If you, are they still in breakout rooms for that? Yeah. Are you gonna close them? Okay. Calling folks back. Closing breakout rooms.
Right.
We'll have a little bit of report out and then some housekeeping announcements. And then we'll get moving for the rest of our day. Alicia, that is like the warmest jacket I have ever touched. It was like, yeah.
Like that.
It's not, on the inside, it's not.
I just turned
It's really soft.
term or something.
Add it to the agenda.
This way.
Like it?
Oh, yeah, that's way. Oh, that's nice.
For what?
It says foam leather, so.
It feels. You don't have to tell us.
Got it on clearance, so.
It's like.
Do we have the breakout rooms back?
Breakout rooms are closing in 15,
Okay.
13, 10.
And then you're doing,
I mean, you can if you want.
not on my presenter agenda, the team building exercise.
This is all that we're doing. We were gonna do something else, but I was told it was too spicy for where we're at right now.
Okay, well,
You want to improv
What
it?
is too spicy?
well, we can't say it
I'll
now.
Later.
Adam, it was actually a hot wings challenge, but I got it.
Okay.
You're gonna save it for the retreat?
Yes.
Challenge.
Who actually runs the show?
So,
Okay, are you all back from breakout rooms, online friends? Can you hear us?
I see a thumbs up from Coop.
Okay, great. All right, so, not a whole lot of necessary report out. Did anything come up for folks that you want to say, like, was something incredible I learned about the person or people I was talking to, or some reflection that I had that I think the council ought to be aware of?
Kyle and I are twins.
I mean, sometimes it's hard to tell you apart in the little Zoom screen.
We had the exact same wording for how to feel included.
We'll share with us.
Two things.
We can do it for both of you.
Small talk and being asked questions.
Small talk and being asked questions.
I was really-
Wild.
It's much easier to do small talk in person for me than virtual. I really find it hard virtually to.
Chit chat.
Yeah.
Yeah,
I mean, one-on-one is, but as a group, it's hard.
absolutely.
It's also just like nice, like I feel like I have never gotten to like really meet either of these two, and I don't necessarily, like I think I'm on a couple of committees with them, but don't necessarily like wouldn't have met them, and we just made like really cool connections, and like it's not like I would just like DM them on Zoom not knowing them before.
Right, be like, hey, Kyle.
I don't know. I Googled you and you seem interesting. Like, found your address. We should hang out.
100%. But like now that you see them as like people, you might be more, it might feel different to be in an online. You actually wrote down his Yeah. Awesome. That's awesome. Jackie and I realized that we are like polar opposite sames.
Same, but different.
Yeah.
Yeah. Switch on what we need, 1 and 2. We need the same things, but different questions.
Like, but yeah. So I needed for number 1 what she needed for number 2, and the other way around.
My reflection was about, some of us had a meeting in the Capitol yesterday, and I realized that what helps me feel included as part of the team is like being approached and engaged. Because after the meeting, like we all stood up and like people started talking in small groups, and I was just kind of standing there, like, what do I do with my hands? And so I just walked out of the room. I'm like, all right, good talk, guys. See you later. Yeah, well, because I'm like, everybody's like in their small groups, and I'm like, okay, see you guys later. And so then I'm like, well,
I was like,
yeah.
no one talking to me.
But then you feel rude
Yeah.
for leaving, and I'm like, oh man.
That's so funny. We need to have all of our meetings in rooms with 2 doors so that when somebody feels awkward, they can just walk out. Come right back in.
I heard that Jesus has the coolest dog I've never heard of.
What kind of dog do you have?
I'm a Catahoula leopard dog.
Cat a what?
Catahoula.
A little freak baby.
I'm convinced it's a guy in a dog costume.
It's human.
She's
Guy in a dog
the worst thing to ever happen to me. I love her so much.
That's awesome. Looks like Emily Cooper, Ebony, Carissa, and Emily all love dogs, which is one of the best things Emily has learned in a while. And Emily is a sucker for mutts, especially those with super goofy fur.
I found out that me, Christy, and Joylene all have a very strong interest in vampires. And we talk about reading Fledgling by Octavia Spencer and Bram Stoker's Dracula, the original novel.
Oh my God,
Got my Octavias mixed up.
not Spencer. That's pretty funny.
I got my actors and my writers mixed up.
Can you put that in the chat?
Octavia is not a super popular name. Okay, work.
My go-to karaoke.
Okay. Vampires. Okay. Anyone else want to add a reflection before we move to our housekeeping?
What I thought was actually interesting is that what question was it that we had like really totally different things here? Feeling included one, right? Yeah. So I had mentioned that it would be nice, like if there's a topic or whatever that is relating to a subject or a topic that I do have some expertise in, besides being a family member, or even when it does include being a family member. It'd be nice for folks to not talk around me, but to actually ask the person in the room, especially when I'm the only person in the room with that lived experience. That's nice to hear. And then, but wait, how did you say? You said
we were almost the kind of the opposite, where I said what makes me feel included is being asked when it's not necessarily in your lane, and it's something that like we all kind of represent our own systems and our own like the seat that we sit in, but yet a lot of us have experiences that aren't just that seat that we sit in. Not just an Oregon Health Plan robot. So just to be asked when it's not about my lane is how I tend to feel included.
Awesome. I just thought it was just nice to like there is like a person, right? Not just the not label. What's the word I'm looking for?
Title.
Credential, title. Thank you. But there's a person there that.
Lovely. Not a robot.
Yes. Well, that we know of anyway.
Well, can you select every picture?
I fail those things every time. They are rigged. They are not real things. Like
Adam, I discovered the key. You have to do worse. Do worse and you'll sail through.
Okay.
Because I had the same problem, but.
Nice.
There is a conversation in here about like, are we in a simulation or not? But I don't want to get too deep into this, right? Because Kyle's like, I know, man. Let's talk about it. There's solid science out there. But last before I just give us a couple of housekeeping things and get us out the door. Okay. So we talked about it a little bit already, but members of the Youth Council are presenting next week at the Alliance Conference in Salacan out on the beach. Anna is moderating, so please join us if you can. Like we said earlier, it sounds like we've got a couple free spots for folks if they want to. There's a job opening at OYA. Anna, do you have more context?
It is the OIA director's position, and it is linked in our PowerPoint. If anyone would like to go be the director of Oregon Youth Authority, I was sent that application. Thought I would just pass that one right along.
You're making eye contact.
Who's the previous director? Is that?
Joe O'Leary was his name?
Yes. And so
Mr. Wonderful. Yes, our.
there are there is some newspaper articles if you would like to understand why that position is open. In all seriousness, there are, some things that have occurred at OA that are pretty troubling. And so whoever steps forward to take that job, I wish them the best of luck. No, seriously.
Yeah.
To do better for kids. And I also just want to say that I believe that the heavy majority of the staff at the Youth Authority are well-intended individuals and are caring and want to do this best work. And so I hope that whoever their next leader is, they are up to that challenge and really do what needs to be done. So
Heard loud and clear. I'll send an application.
Do it. They really do deserve a strong leader, and it's not going to be an easy job. And I think a lot of folks who could do a good job will not want to do that job. Sometimes you need the best people to step into jobs at the worst times, and I think that's what we need at the Oregon Youth Authority right now. And I hope that there's somebody who is brave and strong and kind who will step into that spot and do what those kids deserve.
Would you like us to advocate for you to be on the interview panel?
I would be happy to. I need more tasks on the plate.
Having a voice, right, for
No, I really would be happy to.
Yeah. So maybe that's something that we can, and I can kind of carry forward and just plug to governor's office.
Are you looking for people to serve on the interview?
Oh, no, they're not asking us, but we can tell them.
That we think we should have a voice, yeah.
Yeah, we should definitely have a voice.
Yeah.
We should have somebody else to recommend.
You can recommend
Okay.
somebody.
I'll talk to you afterwards.
Sandra has something to say to add.
Is Sandra Santos still on? I know she jumped off earlier. I don't know if she came back.
She is gone, and
Okay.
Sonia is also.
Yeah, okay. So our juvenile.
And I know that just related to that, Sandra had sent an email out to everyone with a listening session for the acting director. And I think Sonia might have also sent out a statement from Oregon Juvenile Justice Directors Association. And so, there's a lot of movement, a lot of fear, a lot of pain in that juvenile legal system structure right now. And I think our job here at this table is to call folks together and continue to collaborate and to do what's best for kids. And so I hope that we can hear each other and hold space for each other's frustrations and disappointments without pushing each other further away as we kind of navigate getting good leadership into OYA in a way that Sandra deserves to have coworkers that are up to her caliber.
Yeah.
And I'm not trying to insult anybody who's there, right? But we know Sandra is incredible. I want more people like Sandra leading in that.
Yeah, absolutely. Kyle, did you have?
I just appreciate the chance to talk about this here right now.
Yeah.
As a group, because it seems like it falls under our purview, right?
Yeah, it absolutely
Major
does.
part of the system.
And so Annette and I were able to attend that meeting with the acting director, Jana McClellan. What was that, last week?
Last week.
Yeah. And so both of us were able to join and be there for that. I think I think you asked Annette if she would be willing to come and speak to us, and she said yes, absolutely. But obviously short turnaround because that was just last week, and Jana has a lot on her plate. But yes, Kyle, we have asked for her to come. And
that's great.
Yeah.
Yeah, just keep that conversation rolling forward.
Yeah. Meeting updates about these times. So we took that poll, right, about times that folks were available, trying to find a new time, making sure that our meetings didn't get too stale, being 4 hours long, right? And so it's likely that in September of this year, we're going to move to 2 meetings a month, 2-hour meetings.
And I forgot to write it. I was going to write this in, but when I typed it, I didn't feel like looking for it.
Yeah.
Sorry.
You're fine.
It's 3 to 5. 3 to 5 on the first and third Tuesdays.
So that is intended to make it more accessible to young folks to attend, right? Moving to 3 o'clock, understanding that even then they may be a little late, but I'm trying to make it. Yeah, thanks, Joylene. Yes, in the chat.
So in the thinking that I'm doing right now, and y'all can start sort of marinating on this as well, is that for one of those 2 meetings would be the receive information get reports from each other. And the second one would be like discuss and vote, right? So that instead of it, I'm trying to figure out how to make it doable for staff to staff 2 meetings a month rather than just 1 meeting a month. And so I'm trying to think about how to break them up. So like one is the like information receiving and the other is the information giving, or
I think it'd be
something like that.
I wouldn't be like, we're not receiving feedback on any of the stuff. This one, we're just
doing our work. Yeah.
And you can have it so the next one, the listening one, just they get the feedback from the one prior.
Yep, that's what I'm hoping to do.
Legally, you have to have public comment at every meeting, right?
Yeah, but no one ever says anything, so. Well, what happens?
To be fair, I think sometimes the reason there isn't as much public comment is because we allow a fair amount of public engagement throughout the meeting. And so.
And in the committees.
Yeah. So I think that may be part of it, which is a good problem, right? Like if everybody's able to say everything when they're here and don't need to wait, that's great. So that's the update on the meeting times. Public meeting law trainings, April 9th and 17th.
Karina will send out those links again for free trainings for public meeting law.
Karina's like, yep, sure will. Can we think on the flow? We move on the flyer.
PowerPoint notes.
And then there is a Youth Behavioral Health Summit in Lane County on May 2nd. So if folks are engaged in that system of care or participate, please check that out. I'm going to do a call out for Christy and I, because Christy sent an email out last week. And I know that we all read our emails top to bottom. And at the end of said email, Christy mentioned invitations to local systems of care across the state and dates that we would be going to those. And one person responded from the council, I'm not going to say who. Me,
Who knows?
And I openly, gang, I think it's really important that we as the statewide body have membership going to these and engaging with local systems of care. And it's tough for me to try and commit to all of them. So if folks can take a look at that email, maybe Christy will resend that opportunity. And if you can, I know we're all very busy, but try and attend maybe your local one. That's not.
Did you commit to Gobies?
Yeah, I committed all of them. I was the only one that responded. I said, I'll fill in where I need to be.
And then Chrissy
Well, because I already attend the Yamhill one, so I thought that was okay.
I don't know that.
I say it all the time.
Maybe what I'll do is I'll just take this as an opportunity to do some direct outreach around hey, this meeting is happening in your region. Maybe you are interested in getting more involved in your local system of care, and we'll have some polls. But
You can put me down. I go to Metros, so.
And they get excited. They like it when we come because it's easier for them to connect to what's happening at the state when they have somebody like Alicia, like Adam in their local space. And when they escalate something up to us, they're like, oh, well, Alicia can carry that forward for me because she's been here. She knows me. She can translate it for them into state language.
So, so I think that's all the announcements. Do other folks have announcements? The committee, anybody?
I'll try to look at that list of what local ones are and see if I can make it. I have nothing but time now, so.
Could you please resend it? Because I just checked and it doesn't look like I have it.
Oh, really?
Yeah.
Emily Cooper put something in the chat. April 7th. Oh, she put all the
dates. Yeah.
Local system of care dates.
What's the commitment? Is it regular?
May 29th, time TBD.
What was that, Kyle? Sorry.
What's the commitment for the?
Just to show up to a meeting for a couple hours and listen and
on a regular basis, or
this is just a one-off.
And so just be aware of what they do and let them know that you exist and you care that they exist.
I should be able to go to that 29th one.
All this humanizing we're trying to do.
As long as I know what time it is.
Yeah, and the purpose of these particular meetings is really around engaging them in our strategic plan. So we'll be kind of facilitating conversation about, what is your vision?
That's what Christy's doing.
She's going around to all of these different ones to say, how can we engage you locally in what we're doing at the state?
I just show up and throw my weight around and laugh at them if they did something wrong.
No.
They say something funny.
So yes, thank you, Christy. Appreciate you. Thanks for Emily dropping it in the chat. We will have presence there.
One way or another.
One way or another. I appreciate the support. Okay. Any other announcements? All right.
All right. Thank you for your time and participation. Going to give you back 30 minutes of your day. Our next meeting is May 6th, 2025, 12:30 to 4:30 on Zoom.
Were you gonna say something?
Oh, I was just gonna briefly mention that in child psychiatry at OHSU, we expanded our fellowship training to 5 fellows per year. When I was in training, 25 years ago, it was 2 every other year or something. Anyway, we've expanded dramatically and we recruited 5. So,
that's you.
Yeah. Wow.
Hooray, a celebration.
Yeah. That's
All
awesome.
right.
What a way to end. All right.
Yeah.
Great.
Awesome.
Thanks, everybody.
Thank you. If you hadn't signed in before you leave, please do, so make sure you get credit